Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome back to your health live health program coming to you directly from Bradford Icarus TV studios. Before the break, we were discussing something called tinnitus, a illness of the ear, where the individual who's suffering from this, all he hears with varying degrees of intensity at various times of the day is a ringing, buzzing, or kind of it could be any kind of a wishing sound, just basically noise coming from the ear that he think or she is consistently and constantly with varying degree of intensity exposed to. This is known as tinnitus, and I mentioned the reason for it: high blood pressure, noise-induced issues, aging, infections, oxidative stress, etc. So one of the things I wanted to go through was, as a person ages, they have if you leave a kind of a apple out on the table, what will happen is that after some hours, or after half an hour, it'll get that yellow kind of discoloration on it. Now this is because of its reaction to oxygen. Now you and I, as we live on this planet and we do our objective, which is to please Allah in the dunya and prepare for the hereafter, we are breathing in oxygen. All right. Now this oxygen is causing oxidative stress. Yeah. And that's why it's important to have things like antioxidants, pycnogen, vitamin E, selenium, things which are which mitigate and to a degree address this oxidative stress. Like if on the apple, if you put some kind of lemon juice, then that would that reaction would be delayed. So same thing for us as well. Now I want to mention a few things which have been linked to tinnitus. Number one, 2019 randomized double-blind placebo-controlled study, the gold standard. Yeah, double-blind means neither the patient and neither the people who are carrying out. Nobody knows who's getting the real medicine and who's getting the placebo. It's the gold standard. So this research was carried out by researchers at the University of Athens School of Medicine, and they found out that taking something called it's an antioxidant, alpha-linoleic acid, ALA, 300 mg twice a day for 3 months. What did this do? This reduced the subjective discomfort and intensity of tinnitus. It brought it down. The people in the other group, the placebo group, they reported no change. So ALA, alpha-linoleic acid, 300 mg daily for 12 weeks is certainly one method of treating tinnitus. Because I'll tell you why. 83% of people, when asked if their healthcare provider was managing, how well was the healthcare provider managing their tinnitus, 83% reported that the words they use were, let's find out the words they use exactly. Their words were that absolutely not effectively. Absolutely not effectively. So 83% of people were, you might think it's the norm, but 83% of people said that their healthcare provider was absolutely not effectively at all managing their tinnitus. So if you're in that situation where you're going from pillar to post and there's no relief, this ALA could be the solution you're looking for. Number one. Number two, B12 deficiency. B12, we're going to do a whole program on B12 inshallah, but B12 deficiency and then readdressing this B12 with 2,500 micrograms every week, an injection for 6 weeks. What did this do? One study found that first of all, 43% of people who had tinnitus, chronic tinnitus, 43% had a deficiency in B12, and they experienced a significant improvement in tinnitus, the severity of tinnitus, after weekly injection of B12 of 2,500 micrograms of vitamin B12 for 6 weeks. Another study in 2018 found that 28% of people with tinnitus, when they were given just a multivitamin, B complex multivitamin, 28% benefited measurably clinically for their the symptoms of tinnitus. So B12 is amazing. Huh. So that's B12. See, 43% of people who are tinnitus had low levels of B12, and then when they address that, mashallah, it helped them so much. So if you have, B12 deficiency, ask your GP for some B12 injections. We've got a call waiting. Let's go to the call. Assalamu alaikum wa rahmatullah.
Walaikum assalam. कैसे ठीक है?
Alhamdulillah.
I want to ask about sciatica.
हाँ
हाँ तो उसका क्या इलाज क्या है sciatica का?
अच्छा बहन, आप सुनते जाएं इंशाल्लाह, हम आपको बताते जाएंगे इंशाल्लाह sciatica का क्या इलाज है. जज़ाकल्लाह खैर. Please keep listening. We'll mention sciatica. Thank you very much. Jazakumullah. Balki Allah Hafiz. Sciatica, there's different reasons why people have sciatica. All right. Sciatica can happen either because the piriformis muscle is touching the sciatic nerve. Sciatica can happen because you have a herniation of the disc or a prolapse. It could be any single one of, like maybe 7, 8 different reasons. You could have a degeneration of one of the discs or a degeneration of the bones that's touched. In sciatica, what happens? You have two large nerves going on either side from the L5, I think it's L5, right at the base of your, kind of just before your buttocks. There's a small kind of, there's two large nerves, like the way you have brachial nerves going down here, you have the sciatic nerve going down the both legs. Once that is touched by anything, whether it's inflammation, whether it's fluid, whether it's indeed the disc or the bone, the vertebrae, that causes agonizing sciatic pain. It can be from the top, it can be from the bottom, but the key thing is, the causation needs to be addressed. The causation. Now, there's so many homeopathic remedies for this. We have a specific remedy which I personally, mashallah, made myself. It's a mixture of 7 different homeopathic remedies. They are all they're all in conjunction. They're all made together. We normally give this to our patients. Even people with chronic, more than 8 weeks, sometimes many years of pain, find relief with this combination. Because when you're in acute distress, you need to, even though as classical homeopaths we normally give one remedy, but people in acute pain don't have the luxury of waiting. So if you want to contact the admin, they will let you know how to get hold of this, inshallah. But also, if you have any chiropractor near you, go and visit a chiropractor. You have plenty of female chiropractors, mashallah. And what they do is they align the spine. Many people don't realize, I've been with chiros and I've seen when they're doing some people's treatment, a person's foot. So it's like that much difference. So if you see my finger there and this one here, there's like over 2 inches of difference between their feet because they need aligning. So visit a chiropractor, they'll make sure your vertebrae is in good sync and it's not causing any issues to your sciatic nerve. Or if you have a homeopath that's near you, go and visit a homeopath. They have remedies which can help. But if it's a manual issue, if there's an issue of slip disc, etc., then you will need some kind of hands-on treatment, inshallah. Hope that was beneficial. And before we just go ahead, I want to quickly mention somebody phoned in for osteoarthritis and rheumatoid. The single best thing I've found for people with osteoarthritis is that method that I've told you many times, where you emulsify omega-3, or when you emulsify cod liver oil. You take 10 ml of cod liver oil and you mix it with the same amount of Tropicana orange juice in a small jam jar. You hit it on your hand 20-25 times after you mix it, after you put the lid on top of it, and then you drink it in the morning before breakfast, 10 minutes before breakfast. What this does is that it creates synovial fluid. And osteoarthritis, degenerative arthritis, where you have this pain and inflammation and swelling on different kind of joints, and you have stiffness, but it lasts less than half an hour. If you remember, we did a whole program on osteo and rheumatoid, and the person who asked the question, if you actually want to go onto YouTube, and there, if you type in your health, you should find the program on osteo and rheumatoid. We mentioned many effective things there for rheumatoid and osteo. But quickly, I'll mention osteoarthritis. Do this combination of 10 ml of cod liver oil, mix it with 10 ml of Tropicana orange juice, the smooth one, and drink it in the morning and have breakfast 10 minutes after. This will create synovial fluid. In osteoarthritis, you have a deficiency of synovial fluid. In rheumatoid, you have an increase of it. There's too much synovial fluid. So this is good for osteoarthritis. Have this for 6 months, inshallah. If it's going to be cured, it'll be cured with this. We've helped thousands of people by the grace of Allah. Alongside that, if you want to start taking things like glucosamine sulfate and chondroitin, there's a famous study called the GAIT study. 1500 mgs of glucosamine, 1500 of glucosamine and 1200 of chondroitin. Take this for about 4 weeks and you'll see a massive difference. This is only if the osteoarthritis hasn't kind of progressed so severely where you need to have your whole joint changed. And if it is in that state, even then you can use various, stem cells. Nowadays, you can people offer stem cell injections. But what that happens is that in PRP, what happens in PRP is that they take the blood out and they separate the plasma-rich blood and they inject that back into the area. It's been used for about 10-15 years. Many people, athletes use this with very, very good effect. It's used for hair. It's used for joint pain. So that's another thing as well. I hope that's beneficial, inshallah. Okay, so back to the tinnitus. So I mentioned B12. If you have a low B12 and you've got tinnitus, then chances are that you'll find it beneficial. We've got a call waiting. Let's go to the call. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum salam.
Gee, sister, how can we help?
Brother, I get vertigos, but at winter time I get more. Sometime in the summer I get more as well.
Is it many years or labyrinthitis? What have they diagnosed it with, please?
It's been many years, but sometimes it could be 6 months gone by and I won't have any. And then all of a sudden I will have it.
So just dizziness or is it just dizziness?
Yes, my last time I had it, it was my head spin like I was in a marigold. And I was very bad. I have to hold the table really strong.
In a merry-go-round, you mean?
Yes.
Okay.
Yes.
All right. So which way do you fall then? Left, right, forward, backwards? Is there a pattern?
I didn't fall. Luckily, I was very next to the kitchen table, so I sat out on the chair and I hold the table.
Do you have any history of this? Anybody else in your family have the same issues?
My elder sister has, but then she always had ear problems.
Right.
She gets infection in that.
What about you? Thank you. Do you have ear infections? Have you had ear infections?
No, I don't.
Never.
I don't have ear infection.
Do you suffer from low blood pressure?
No.
Do you check your blood pressure?
Yes, I do. Low and high, both. They're very, very reasonable.
What is your blood pressure on a normal average?
During the day, it can be 40-something, but in the morning and evenings, it can...
140, you mean? That's systolic. What about diastolic?
Sorry?
What about that's systolic 140, I'm assuming. It can't be just...
73. And then in the morning, it can be 130, 72.
That's good, mashallah. Okay, sister, keep listening. We'll come back to you.
But I get sinuses as well in the winter, very bad.
Yeah, that can cause this. Why do you stay away from dairy products for 2 weeks and start...
Say that again, please?
If you stay away from... It's a good thing for 2 weeks, stay away from all dairy products. 2 हफ्ते के लिए बिल्कुल dairy से परहेज करें, cows, milk, eggs, cheese, butter for 2 weeks and have plenty of garlic and onions. That's just off the top of the head, just to clean you out for 2 weeks only and see if that makes a difference. But if you're having it every 6 months and you're not having it daily, is that right? It's every 6 months?
Yes, that's right. Yeah, just once in a blue moon, it'll just come.
Because sometimes you can have something known as... Is it when you're standing up from somewhere you feel this?
Often, yes.
It sounds like...
even when I get up in the morning, sometimes it can happen.
Yeah, it sounds like postural hypertension. If you have the low blood pressure, जब आपने उठते हैं ना ज़मीन से, especially first thing in the morning after being sitting prolonged, you can have postural. Check your serum check your serum ferritin levels, your iron levels, iron store levels, and check your hemoglobin.
They're all fine. Everything is fine. I take B12 as well.
Oh, you do? You take injections or you take the tablets?
No, not just the tablets.
Yeah, tablets aren't very good, to be honest with you, madam. They're about 3-4% of absorption. The B12 injections are a lot better. But no problem. Please keep listening, inshallah. And
thank you so much, brother.
You're welcome. Allah give you shifa. Jazakallah.
I don't drink milk or anything like that. I do eat yogurt.
Same thing.
I got colitis, so that's one reason I don't drink milk.
You have colitis?
Yes, I do. I've been suffering that for years.
Ulcerative colitis?
Yeah, the bowel syndrome one.
Yeah.
I get diarrhea if I'm not careful, but with my diet control, I'm okay.
You should definitely, thank you. You should definitely consider, if you have colitis, are you taking prednisolone, immunosuppressants?
No, I am not.
You just control it without medications, mashallah.
No. The doctor's given me. I take Mezalin, MEZAB. Yeah,
that's fine. Jazakallah. Okay, sister. Well, you should do if you have
2 tablets.
If you have colitis, which is inflammatory bowel disease, you should definitely consider, because it's a disease of the large bowel. Yeah.
Yes.
What you should do is you should look into a food intolerance test, an IgG antibody test. इससे आपको बहुत फ़ायदा होगा. Number two, you should look at things. There's a powder, glutamine powder. Glutamine powder repairs the damage to your gut wall. वो शरीर की तरह होती है. Over time, it repairs the damage, which is what happening with ulcerative colitis. You get ulceration in the large.
Can I listen to you now and put the volume up, please? On the phone, I can't hear everything.
Okay. So, sister, inshallah,
thank you so much.
What to do
thank
is
you
that,
so much, brother.
You're more than welcome. What to do is that we'll continue with the program, but if you do want to listen, this program will be on YouTube after this, inshallah. You can go back and listen to that. But I just mentioned two things. One is that you should take a food intolerance test and a blood food intolerance test, an IgG antibody test. Identify the foods your body is making antibodies to, eliminate them for 3 months. And number two, start taking glutamine powder. Glutamine powder is very, very good for healing the gut, which is where you have the ulcers. Okay, sister. Jazakallah. Assalamu alaikum. Okay, so back to B12. We've got limited time in Lillahi when we've only got 6 minutes, and this is why I normally don't take the calls from our receptionist here, Adil, because I know we'll never get anywhere. Otherwise, the phones are ringing off their handles, and this is a case in point today. But chalo, if it's benefited somebody. So if you have low B12s and you've got tinnitus, make sure you take B12. Another thing which is very good is ginkgo biloba. Ginkgo biloba, G-I-N-K-O, ginkgo biloba. Ginkgo biloba is a very good, if someone's had a stroke, ischemic stroke, or an aneurysm, either the blood vessel has burst, or number two, it's actually been clogged with the fats and the blood has not gone to a certain area for over 24 hours, and you have that area dying, you'll have symptoms in the other side of your body. So ginkgo biloba has been proven to, it's a blood thinner, but it pushes blood to the extremities. And what happens after stroke is you need blood going to the area to get rid of the lesions and make sure the area is nourished. It can, according to some studies, cause a 50% increase in the recovery rate. So somebody, if you imagine, has got one arm and one leg that they can't use due to the ill effects of stroke, that can be brought down to one arm or one leg. It's a very, very big thing. So ginkgo biloba is also good for tinnitus because it pushes blood to the extremities. It's very good for other things where you have issues due to blood not going to the extremities. But tinnitus ke liye bahut acha hai. It's been used. Ginkgo biloba has been used by Chinese medicine for thousands of years. They use the leaves, and it can be very, very effective for issues with the ear. And according to the Florida College of Medicine and the Michigan Ear Institute, they say based on the evidence, ginkgo biloba ought to be in the treatment repertoire of a physician's approach to patients with tinnitus. So you can get hold of ginkgo biloba very easily. It's for colder hands and feet because it pushes blood to the extremities. Iske baad, two things. One is zinc. Zinc is very, very good. Zinc, normally you take 15 mgs, but if you have tinnitus, then you should increase that. The authors say of various studies to 30 mgs. You can do 30 mgs for the first month, double that dose, because elderly tinnitus sufferers who had lower zinc levels, in one study, 82% of these people responded very, very favorably after supplementing with zinc for 8 weeks. Another study of 2,225 participants with the 640 people with tinnitus found that blood zinc levels were only significantly lower in those with extreme tinnitus. So either way, tinnitus is another thing that can help you with, zinc is another thing that can help you with your tinnitus. Sometimes drugs can cause your tinnitus. Drugs like aspirin and other non-steroidal anti-inflammatory drugs like ibuprofen, they have been shown to cause tinnitus in people who have taken them for a long, long time. ACE inhibitors, angiotensin receptor inhibitors, blockers, which are used for high BP, they can cause ringing in the ears. Same thing with the ACE inhibitor called ramipril, that can cause tinnitus as well. And any antibiotics that end in MYCIN, streptomycin, gentamicin, all these antibiotics can also, one of the side effects is hearing loss and tinnitus. So just be aware that your own medication can be causing you these symptoms. And then magnesium. Magnesium is a very, very good, mineral for. I mean, it's just like vitamin D. It has so many reactions. It takes part in so many reactions in the body, and also it's another mineral that is essential to cellular and nervous system function. Research has found people with catastrophic and severe tinnitus were very, very low in magnesium. People who took 532 mg of magnesium daily found they had statistical improvement on the tinnitus the symptoms. Another thing you can try, and I mentioned this earlier, 50% of people found relief with this. It's very, very common. It's very, very simple, and 50% of people who tried it found great relief. And the way to do it is you hold your both hands over your ears like this, so the back of your hands are going. So the fingertips are going to the back of your head, and then what you do is that you put your not the middle finger, these index finger on top of your middle finger. Yeah, so you like this, like holding like this. So this finger, index finger, will go on top of your middle finger like this, and then you're gonna like use it as a drum. It'll do that action. If you see that, like that, and then you hit it. So do this, and you're gonna do this 50 times. 50 times. You cup your ears and do this what I've suggested. Put your index finger on top of your middle finger and then hit it. And you can try it now as you're watching. All you do is that when you're doing it on the back of your head, it's like a percussion instrument. You can feel the thudding sound. You do this 50 times. If you have this tinnitus, do this 50 times where you're hitting your index finger after putting it on top of your middle finger, and then using the force, simultaneously together, and hitting it on the back of your it's actually the area just behind your ear you're hitting it. If you do this 50 times, mashallah, 50% of people have found great relief for tinnitus. May Allah Ta'ala give all the people who are ill with different illnesses full shifa. May Allah reward the people who are living with illnesses in its various forms. May Allah give them full shifa, and may Allah Ta'ala make it a means of elevating their ranks in the hereafter. Unfortunately, again, we've run out of time. We're going to continue with the same program, inshallah, and go through the homeopathic remedies and a few more things I've forgotten to mention. Next week, inshallah, please join us then. If you have any questions, please phone in, email us, anything that's easy for you, let us know, inshallah. May Allah continue keeping us safe and in His protection. May Allah keep us safe from all musibats and calamities. And until next week, Assalamu alaikum wa rahmatullahi wa barakatuh.